Good day everyone, my name is Kenneth D. Velasquez, Section 12A, Group 4, and a student nurse from Davao Doctors College. Today, I will be showing you my return demonstration in performing hand washing or hand hygiene. This procedure is really important because it is considered one of the most effective infection prevention measures and it deters the spread of microorganisms. Before we start, we need to check for the completeness of our supply. So the materials that we need are liquid or bar soap, but I have bar soap with me, sink with running water, tissue paper, a trash bin here, and of course, lotion, but this is only optional. Completeness and organization of all our materials ensures our efficiency as nurses. And now that we are all set, we can now proceed with the procedure. First is that we need to stand in front of the sink with the uniform not touching the sink for the entire procedure, because this sink is considered contaminated, and of course, if contaminated, our uniforms may carry organisms from one place to another. And also, we need to remove our jewelries because it's recommended and it facilitates proper cleansing. So I don't have any jewelries here with me, so we can proceed with the procedure. After that, we can now turn on the water and make sure to adjust its force, because any splashes of water from the sink to your uniform is also considered contaminated. So be careful with this part. And now we need to wet your hands from the wrist area to fingers pointing towards the bottom of the sink. But always remember that your hands need to be always below your elbows because water should flow from the cleaner area towards the more contaminated area. And of course, at the same time, inspect condition of cuticles, hands and forearms for abrasions, cuts or open lesions, because a nurse who has any open sores may require a work assignment with decreased risk for transmission of infectious organisms. So since I don't have any abnormalities or lesions in my hands, I can proceed with the procedure. And of course, now we need to lather our hands thoroughly with the bar soap. This is thoroughly, and return this one, and then wash your hands and wrists for about 15 to 20 seconds with firm rubbing and circular motions, because this creates frictions that helps remove microorganisms mechanically. And now, interlace your fingers and rub the palm using the back of the hand for at least 5 times each. And for you to be informed, interlacing our fingers will help clean the interdigital spaces. And of course, rub palm to palm with the fingers interlaced. And of course, rub the back of the fingers to opposing palms with fingers interlocked. Now, we need to rub each thumb clasped in opposite hand using rotational movement, just like this. And also for you to be informed, this assessment consists of a minimum of 40 seconds and a maximum of 1 minute. And please make sure to keep the faucet running because we will be turning that off later. Next is rotational rubbing backwards and forwards with clasped fingers of my left hand to my right palm and vice versa. And lastly, I need to rub each wrist just like this and also include this part to avoid any contamination and for cleansing. Proceed to the other. And after this one, you need to rinse this thoroughly and inspect for remaining dirt or soap with the use of running water. So this running water will help us to rinse organisms and dirt into the sink. And please make sure to observe a proper body mechanics and do not touch the sink, especially with the splashes. Check for soap. And after this one, dry your hands from finger to wrist with a hand or paper towel. I have it here. This is finger that starts with here. And throw this one if it is wet. Finger to wrist. Now, on the opposite side, throw again and get one if you need. So after that, you use your paper towel because this will help our skin to prevent from chapping. And of course, lastly, we need to turn off the faucet with the use of the same paper towel. And throw this one. And the last procedure is that you can use lotion if you desire. So since I don't desire, I will not use this lotion. And of course, that's it for our hand washing. And I just want you to be informed that there are 5 moments of hand hygiene. First, before touching a patient. Second, before a clean or aseptic procedure. Third, after bloody fluid exposure risk. Fourth, after touching a patient. And lastly, after touching the patient's surroundings. So again, I am Kenneth Velasquez, Section 12A, Group 4, and a student nurse from Davao Doctors College. Thank you and goodbye.